I'm Robin Ireland, but we'll just wait a minute or two while people are joining. I can see the numbers going up, so gradually people are coming in. So I'll start formally in a minute or two as we wait for people to join. Got quite a lot of people joining us today, which is excellent. And although I can't see you, lovely to have you here. Nice to see you, Alistair. I'm probably going to ask you to turn your camera off until you're ready to present, if that's all right, but it's good to see you. So I'm reassured you're there. Thanks. I'm just watching numbers go up. Once they stabilise, I think we will make a start. They're still going up gradually, so we have got plenty of time today. I'm absolutely certain we will conclude by 1 o'clock. We may finish a little bit earlier, depending on questions and answers later and how long we are with the presentations. But I think I'll give it just about another minute and then we'll get going. I'm very grateful for people's time. And it's getting towards lunchtime, depending when you have your lunch. Okay, I think I will make a start now, if that's okay. So, as I said, I'm Robin Ireland. I'm the Honorary Director of Research for Food Active. It's my pleasure to welcome you to today's Healthy Weight Declaration webinar, engaging partners in the wider declaration. This is all about launching new tools as part of the Healthy Weight Declaration to support place-based and system-wide approaches to healthy weight. So great to have such an attendance. I was saying to my colleagues earlier that where I'm sat, which I'm working from home, this is the day my neighbours below, I'm in a flat, have decided to do some work on their electric. So if I look distracted at any time, it's because of drilling going on, which I'm very relieved you can't hear. I also lost my electricity totally for 5 minutes yesterday, so let's hope that doesn't happen. We're going to ask delegates to put questions in the question and answer box. So that's to be aware of later. Can we have the next slide, please, Beth, if that's possible? And also, this gives me the opportunity to say, just to try and make things a little bit easier today. Beth at Food Active is going to progress all the slides for both myself and all the speakers. I think that just makes it a little bit easier when it's a short session. So please forgive that. Next slide, please, which will come a little bit. So I'm going to be talking about a little bit initially about the Healthy Weight Declaration System Leadership. I don't intend to be too long on that because there's more important people speaking later. As you can see there on the programme, Nicola will then give an overview of the NHS Healthy Weight Declaration. I'll introduce her at that time, to be followed by Dr. Alistair Blair and Lisa Davis from the Northumbria Healthcare NHS Foundation Trust to speak about their work, and the NHS Healthy Weight Declaration will then go on to Beth, who will introduce the schools pledge for a healthy and active future, and then we'll hear from Jack Waddle from St Bartholomew C Primary School at Army Leeds, who Beth tells me is still teaching, but hopefully will be able to join us in time for his session. And good on him for finding the time. In fact, good on him and Alistair and Lisa for being able to join us today. I think it'll be a really helpful session. I've already mentioned about please put any questions in the Q&A box. That's the only way we're going to be able to take them today because of time, really. All details about the new tools we'll be talking about today will be circulated to delegates after the session. can I ask people to keep the cameras off unless they're including the speakers until when they're presenting, and when they're presenting, my camera should also be off. If it comes on, it means that you're coming very close to your time allocation, so it's a sort of polite warning of that. I think that's probably about all I need to take on. Obviously, please keep your microphone on mute if you're not speaking. So hopefully that's it that I'm supposed to do. So let's move on. Thank you very much, Beth. If you haven't heard of Food Active, it was and still is a collaborative program that was launched in 2013 to tackle increasing levels of obesity. And it's always taken very much a population level intervention, looking at socio, environmental, economic, legislative factors, and in effect the obesogenic environment. We try and sum it up as less victim blaming, or hopefully no victim blaming, more environment framing. It's one of two core programs delivered by the charity, the Health Equalities Group, and it's worth emphasising that we are a charity. We get no money from central government, and all the work that you're talking about today is effectively being commissioned by partners, usually local authorities. So next slide, please. That's me. I've introduced myself. So I'm going to just do a very small bit about why the Healthy Weight Declaration, something about system leadership, which, as I say, I don't want to be too long on. We know these are difficult times, aren't they ever? Congratulations to the Welsh Government today, who've announced they are going to do work in terms of buy one, get one free schemes. Really delighted they are going ahead, because this is a difficult climate, and it's very frustrating for probably you even more than me, particularly if you're working at local authorities or you're working in an NHS trust. There's practically no funding coming nationally, or that's what it appears from where we sit, or where there's funding, it's often around drugs. Are we looking enough about prevention? That's how Food Active was born way back in 2013, by sheer frustration by local directors of public health in North West. I should say that work that we started back then in 2013, we launched the first Healthy Weight Declaration in 2015, Blackpool being the first to adopt in 2016. That's 7 years ago now. The context for that hasn't really changed, in that there is so little, in my view, happening nationally to support, and particularly public health budgets being reduced proportionally in terms of how inflation is going up. At the same time, we see, with the exception of the Welsh Government, rolling back in terms of national obesity strategy around marketing, which is very depressing. So local action is even more important. We do what we can. Next slide, please. So what are healthy weight declarations for? I've used this slide a lot, so forgive me for people who've seen these before. It's about strategic leaderships and opportunity for senior officers and elected members. The elected members is very important there. Sometimes we haven't involved them as much as perhaps we should. They do and should be representing their local community. They are accountable. Signing up to a declaration makes that statement very, very clearly. It's not about signing a piece of paper. It's a commitment to a number of policies. Local awareness, it shines a light on the importance of key activities internally and externally, and supports local community activities, very much driving activity, which I think we'll hear about from both the case studies from Northumbria Healthcare and from St Bartholomew's in Leeds. Next slide, please. Slightly complicated slide. I would recommend, actually, sometimes for those of you who aren't familiar with it, PHE's guide on addressing obesity, which came out, or whole systems approach to obesity, which came out in 2019. It's quite complicated, it's quite academic, it can be quite off-putting, but some very good things within that as well. I've just taken this slide very briefly to say that, unfortunately, sometimes when we take a whole systems approach, we can go on the easier side of it sometimes, and we can look about trying to convince people to change their behaviour. We can go quite downstream. It's sometimes quite easier, isn't it, to put on classes for people, as opposed to, for instance, looking at policy level. So if you're taking a whole systems approach, you need to look right across the piece, as it were. This diagram here is all about changing behaviours and system behaviours. System leadership is incredibly important, and sometimes, as perhaps, if I can be political, hopefully with a small piece, to say that it takes courage from government, both at national and local level, to make appropriate policy based on the evidence around healthy weight, which we saw Wales do today. Next slide, please. So this is really, I guess, where I'm coming from very strongly. All the evidence around the whole systems approaches, and I've spent quite a lot of time working in this area for a number of years now. So the system leadership is one of the hardest to actually achieve. I was involved with an event in Scotland a couple of weeks ago where we had somebody coming over from Amsterdam, not Karen Den Hertog, but very much what we've seen from Amsterdam and other parts of the country at different times. That's in Holland, obviously, but across England and other parts of the UK, leadership is not about a position or a title. It's actually an example, to quote Karen Den Hertog from Amsterdam. And as we've seen, that's very much where, for instance, councils across England, such as Leicester, they've adopted a healthy weight declaration. They've done it at senior level. In this picture, you've got the elected mayor, you've got the director of public health, and you've got the cabinet member for health and well-being. Next slide, please. We've already made this comment. This is a senior officer from Leicester City Council signing up both their personal and their organisational commitment. Next slide, please. I just leave this with you. I'm conscious of time and I want to move on to hear about the NHS Healthy Weight Declaration next, but this is a slide perhaps to actually think about. Not all population interventions are the same. Some rely on individuals to use their personal resource or agency to benefit. If you just put a cycle lane out there, however laudable it is, and I'm a huge supporter of cycling infrastructure, for instance, you still need to support people to be able to use it. So we need to look at the type of the upstream determinants where we can, in terms of income, in terms of employment, what makes it easier for people, how can we change that environment? That's when we know we're really starting to address some of the determinants of healthy weight. Next slide, please. So healthy weight declaration can be used to support system leadership in other settings, and that's what we're going to hear about. Next slide, please. So thank you for me, and my next slide. Right. This is my cue as the drilling appears behind me and I'm trying to ignore it. I'm going to introduce Nicola Calder, who's the Food Active Programme Lead, to introduce the NHS Healthy Weight Declaration, followed by, to save me coming in again, Dr. Alistair Blair, who's the Medical Director, and Lisa Davis, the Operational Service Manager of Northumbria Healthcare NHS Foundation Trust, to share their experience of adopting the NHS Healthy Weight Declaration last year. I'm going to turn my camera off, and if anybody from the speakers sees me coming back on, it's just to give you a gentle nudge about time. So Nicola, you're next.
Thanks, Robin. If we could just move on to the next slide, please, Beth. So just by way of a brief overview to the development of the NHS Healthy Weight Declaration, this came about following growing interest from NHS colleagues in developing a bespoke declaration specifically for NHS organisations, and with support from Public Health England, NHS England, and also Diabetes UK in the South West region, a pilot programme of work was taken forward. So it's very much about providing a mechanism for NHS organisations to support patients and staff to achieve a healthy weight. So taking a joined up system-wide approach to tackling obesity at a local population level. Next slide, please, Beth. So why is the NHS Healthy Weight Declaration of value to NHS organisations? The declaration can support organisations meet a number of key priorities, and these include commitments in the NHS long-term plan in regard to prevention. It also sits in line with the government's childhood obesity plan. It provides opportunities to promote healthier environments in NHS settings, So examples such as addressing vending and promoting healthy food and drink provision within hospitals, looking again at opportunities within the new national standards for healthcare food and drink. It provides opportunities to reduce inequalities by supporting NHS organisations in their role as anchor institutions. It also supports the NHS People's Plan in terms of the health and wellbeing of staff and workforce development, and also the rollout of the NHS Digital Weight Management Programme. So there are 13 core commitments which are based around themes such as staff health and wellbeing, active travel, procurement. We also look at brief intervention, weight stigma, delivery of national NHS programmes such as the Weight Management Programme, and also addressing working with partners across local systems. So all of the commitments within the declaration were agreed in consultation with stakeholders across the South West. And there's also an opportunity for different types of NHS organisations to agree organisational commitments based on their speciality or area of work. Next slide, please, Beth. So as we've highlighted, the NHS declaration was piloted in the South West by 4 trusts based in Bristol, Cornwall, Devon and also Somerset. So colleagues here tested the framework and the core and organisational commitments, and we're really pleased to share that in November 22, Northumbria Healthcare NHS Foundation Trust were the first NHS organisation to formally adopt the declaration. So this was very much around taking a place-based approach to healthy weight in the North East, alongside North Tyneside Council and Northumberland County Council. And as you know, we're joined by colleagues from Northumbria who will be speaking shortly and sharing their experiences. So finally, before I hand back to colleagues, I just briefly wanted to reference the resources that are being launched today that will support NHS organisations in adopting and implementing the declaration. So we have an evidence brief which provides the rationale and evidence underpinning the commitments within the declaration. We have a Healthy Weight Declaration support pack. So this includes case studies and learning from the pilot and process evaluation, and also includes a step-by-step guide to adoption. We've developed an audit tool and scorecard, which supports monitoring and evaluation post-adoption of the declaration, and a brief how-to guide, which provides information for partners and NHS organisations who might wish to consider this approach. So we will be sharing further details at the end of the webinar about how to access these resources. And just briefly before I hand over to colleagues from Northumbria, I'd just like to take the opportunity to thank our colleagues in the South West for their support in piloting the approach. Thank you. And I'll hand over to Alistair and Lisa.
Hi, everybody. I'm just going to give a quick introduction before I hand over to Lisa. I think I'd like to comment on this. I suppose the first thing is that we have done this jointly with our local authority colleagues. I think as a foundation trust, there's always a feeling that, is this about our patients? And yes, it is, but actually, we're one of the major employers in the area, if you look at that, plus the local authority. It's quite a significant amount of the population. And I think when we often think about these initiatives, actually it matters for your own staff. There's a bit about setting examples for your own staff and how that ripples in the society in which they interact. So I think that's really important. So all of that's been really helpful in terms of trying to carry this through, galvanizing bits across the society. And I think we forget things like we've already mentioned the buy one get one free and things. There is a bit where this is also related to health inequalities. We know that a lot of the cheaper foods are actually some of the more calorific and things. So actually we've also looked at, with our kind of corporate social responsibility, have we got inequalities in our own staff population? And yes, we do. And does this sort of dovetail with our approach to inequalities? And absolutely the two are synonymous. So that hopefully gives an overview. I do think it's helped that we've got senior buy-in from the exec team in carrying this forward. Can we go on to the next slide, please? And then we've got senior leadership buy-in, at board level. We have regular meetings about this, which really just make sure that the actions that we said we were going to do, we are doing. A lot of work about benchmarking in the past, but actually now going on to very much this being a live project with regular catch-up meetings to ensure the progress on the trajectories. And I'm going to hand over to my colleague Lisa.
Thanks,
Next
Alistair.
slide, please.
Hi. So yeah, I'll just cover a little bit. So we are now in the implementation phase of our action plan, which, as Alistair said, we developed at the back end of the year and we launched that in November. And as Nicola said, it's kind of been a pledge from the organisation to kind of align our policies and our prevention agenda to the healthy weight outcomes so that we can benefit our staff, patients and the wider community. We're looking at this from a strategic level, but also our action plan comes, you know, sort of right down to some very specific place-based things that we want to do, which I'm going to come on to cover in the next slide. We've also looked at things like where can we thread healthy weight through all of our relevant trust policies. So it's just triggers for people when they are writing a policy or policy. Is there an enabler there to get something in around the healthy weight declaration? And we're also working very closely with our local authority partners for that whole systems approach, and I attend both local authority meetings just to kind of keep that joined up work. And then hopefully our key aim is that we'll contribute to this wider system work and to reduce the impact on poor health. Next slide, please. And the next one. So I'm just going to go over sort of a snapshot of some of the work that we're doing. So commitment 1 is around providing workplace health programmes that support the health and wellbeing of our staff. So some of the things we've focused in on is we offer a mini MOT for staff, which is like a mini health check, if you like. And we've been using data from our staff health needs assessment to target the harder to reach staff and do some targeted mini MOTs with those staff. We've also worked with our colleagues in OC Health to look at introducing a home blood pressure monitoring offer. So anyone who does have a mini MOT and their blood pressure is high, they get the offer to do home monitoring with OC Health in the hope that we can detect possible hypertensions. We've also looked at the development of a physical activity staff referral service. So within the trust, we have the Wellbeing Centre and staff gyms on different sites. So this links to staff who, you know, may be being seen by physio for musculoskeletal issues, that they can then be referred into the staff gym. And we've also launched a Cook and Well on a budget for staff. And again, that's around regular comms that go out with recipe suggestions on how people can cook lots of different meal options on a budget. Next slide, please. Thanks. So commitment 2 is around an infrastructure that enables active travel. So within this commitment, we're looking at the development of cycling to work schemes and the expansion of cycling hubs, which is working well at North Tyneside. We are looking at introducing a sustainability offer role. That's a role that's out for recruitment. In fact, the person may have been recruited but hasn't started with us yet. So this one's in very early days. We're looking at piloting e-bikes and looking at maybe our community nurses using the e-bikes to travel to their appointments where they're of a short distance. And we're also looking to implement a sustainable and active travel working group to help develop a lot of the active travel initiatives across the organisation. Next slide, please. So commitment 3 is around reviewing the food and drink provision across the trust. So as part of this, there's an implementation of a catering task and finish group, and that will look at all aspects. It's reviewing the catering communication strategy on the healthy choices so that as staff and visitors and patients who use our canteens and cafes, it's very clear which the healthy options are and ensuring that the healthy options aren't more expensive than the unhealthy options. We've also got a fruit and veg stall at one of our sites, and that's been really successful. So there's plans to roll that out to other sites. And we've also been doing a review of the vending across the organisation and having more sort of responsibility for what goes in the vending machines ourselves, and ensuring that staff who work out of hours have access to healthy meals via the vending options too. So that's in the early stages. Next slide, please. So commitment 8 is around committing to train our staff in MEC. So we know that what we want to do, as Robin talked about, is that prevention agenda, and we feel that MEC's one of those mechanisms. So we have a plan in the organisation to roll out MEC Train the Trainer and core MEC training, and that's been in place since September. We've got 650 staff who've now been trained since then. We've developed a support package for our Train the Trainers so that people aren't going back into their area and feeling unsupported. We've been introducing MEC training with our medical students over the last 12 months, and we've now trained all of our first and second year medical students in core MEC. We've implemented MEC into lots of our existing training programmes to give it that sustainable element, and we're now looking at embedding MEC in clinical teams and working with the clinical teams to do pilots and build case studies so that we can then evaluate the impact of the training. Next slide, please. Commitment 14, this is a big one for us, and that's maximising the clinical and patient experience in relation to weight stigma and weight bias. So we have a plan to do some audits across our trust environments and ward areas, reception areas, with patients with lived experience to get their views on what our environment should look like, and then also ensuring that as we revamp areas or we build new areas that we factor these things in terms of appropriate seating, space between seats, scales, blood pressure monitors, things like that. We are also developing a training package for our staff to help staff have conversations about weight, as staff have said that that's one of the areas that they struggle to start a conversation with. And we're working with Keele University to develop an interactive tool that will support staff to be able to have those training opportunities on a kind of a one-to-one as opposed to in a group setting. And then we're also developing a strategy around that training. Next slide, please. Commitment 16, this is around supporting healthy weight in pregnancy, and there's been lots of work, really good work done within this area, and looking at having a dietitian input into the BMI pathway. We've also got a health coach who now works into the BMI pathway, just again to support people further upstream around that prevention agenda. We are continuing to roll out the physical activity midwife-led sessions, so they do sort of buggy walks and aquanatal sessions with pregnant ladies. Also increasing access to specific postnatal weight management programs and health psychology research planned related to high BMI and emotional eating. Next slide, please. So in terms of our next steps, as we said, we launched in November, and we've kind of moved into the implementation phase. So we continue to meet as a group on a quarterly basis, and we capture a quarterly summary of updates on all of the commitments within that meeting. We've got key individuals who are the lead on each of the commitments, and sort of they're leading the change, if you like, and doing the feedback. We continue to progress updates up to board via Alistair and Kate, and we continue to work with our local authority colleagues to align the plans and priorities. And I think we're always looking for opportunities. We've got our set plan, but if something new comes along or there's a new opportunity comes up, then we will feed that into the plan and embed that within the work we're already doing. Next slide, please. And that's us. Thank you.
Thanks so much for keeping to time. That was incredible amount of detail actually in a short time. So thank you for that. Can I just say there will be opportunities to ask time permitting, to ask speakers questions later. I noticed that we have one question in the Q&A, so thank you very much for that. Please add your questions if you have any. We may not be able to take them all at the end, but we will do our best. I just wanted to say that Alistair set the context excellently in terms of the trust being a major employer, and also to highlight, of course, that there are health inequalities amongst our own staff, and the kind of work they're doing helps them address that. And then Lisa talked through in detail about the commitments and some of the issues and how they're getting on. So hopefully that gave you a feel of what the NHS declaration is about. Can we have the next slide, please, Beth, if that's okay? Thank you. So we're going to go on now to talk about the other new tool that we're launching today. Beth Bradshaw, who's the Food Active Project Manager, will be introducing this, which seeks to engage schools in the Healthy Weight Declaration through adopting their own commitments to promoting healthier weight. And subject to having managed to get away from his teaching, a pleasure to have Jack Waddle, who's going to follow Beth. I won't introduce you separately, Jack. Beth will just put your slides on up when she's completed. Jack is years 1 and 2 teacher, PSHE lead at St Bartholomew's at C of E Primary School, Armley in Leeds, who were involved in the pilot of the pledge last year, the first school to adopt. And again, if I can encourage you to put questions and answers at the end of this session will be recorded and will be made available, and there'll also be details about both the NHS declaration and the schools pledge will be emailed to you afterwards. So I will stop talking and hand over to Beth at this point.
Thanks very much, Robin. And thanks to Lisa and Alistair for a fantastic case study there on the NHS Healthy Weight Declaration. So as Robin said, I'm going to be talking a little bit about the other tool that we're launching today, which is more around how we engage schools in the healthy weight agenda and support a whole systems approach to healthier weight. So, and we've done this through our school's pledge for a healthy and active future. So in terms of the development of this pledge, I suppose the initial concept really came about from a conversation that we had with colleagues at the Health and Wellbeing Service at Leeds City Council on how we can try to engage schools in the Local Authority Declaration on Healthy Weight, which the City Council had adopted back in 2019. So it was really thinking about how can we kind of support wider partners across the system, including schools, in the declaration. So together we set out to develop a set of commitments and tested them with a group of schools and really thought about what can the school do within the school environment to support and promote healthier weight. So we tested those with a group of schools, developed a range of support materials for the schools to use to guide them through the process, and we decided to set up a pilot to test this out, test all of those resources, but just test the whole process as more generally with a small group of schools in 2021 to 2022. And I suppose the pledge is really about, again, thinking about that commitment. We've said that quite a bit today, but providing a clear commitment to creating a culture, an ethos, and an environment that makes the healthy eating and being active easy and accessible for the pupils, but also staff and parents as well. It provides a framework for schools to work towards through an annual action plan that they'll develop as part of this process, and it addresses a wide range of different levers and opportunities within the school. It's also a really great way to highlight good practice, so what the school is already doing well, but also highlight areas that perhaps the school could improve on. And it really provides that kind of shared and consistent vision and approach within the school around healthy eating and physical activity. So I won't go into all the commitments in huge detail. I've just summarised them very briefly on this slide here. But as part of the pledge, schools will commit to working towards these 12 commitments. There is also an opportunity for schools to adopt their own school-specific commitments as well, if there's a particular need of the school. But in addition to committing to work towards these pledges, it's also a way for the schools to pledge their support to the Local Authority Declaration as well. So based on these commitments, what schools will do is they'll use using an action planning tool that we've developed, they'll essentially mark where they are up to against all these commitments. So essentially score themselves at baseline. And then through consultation with parents, pupils, senior leaders, leadership teams, other members of staff, develop an annual action plan to help prioritise and frame an action plan for the next 12 months. And like I said, it's also a great opportunity for schools to flag up work that they're doing really well, take stock and highlight areas that they can perhaps do some more work on. So we're launching today a range of resources that are designed to support schools along the whole process of adopting. We developed these a support pack for the pilot that's gone through a lot of feedback. We've gathered some great feedback from the schools involved in the pilot, and then we've developed a range of resources. I think it's over 20 resources within the support pack, from consultation resources, assemblies for pupils, letters to parents, local businesses, tons and tons of stuff in there. And where we see this fitting is we see this being led by a local authority public health team, and what we've developed is a step-by-step guide for the local authority lead to take this to schools. So advice on how to engage with schools, learning from our experience in the pilot, but also how they can support schools through the process as well. Lots of additional resources there. And I'm really delighted that we've got Jack along the call today to talk through his experience in adopting the pledge. And it was a pleasure to work with Jack last year alongside colleagues at Leeds City Council, who unfortunately can't be here today. But a huge thanks to them for their work as well. So I'm going to hand over to Jack now, and he's going to talk you through their experience in adopting the Pledge for a Healthy and Active Future. Thank you, Jack.
Thank you. So do you want to go to the next slide? So I'll talk you through our journey of how we adopted the FAF and how it went from there. So we received an email from School Food Friendly, who are the people Leeds City Council that work with Beth, and the senior leadership team in my school had a look at the pledge. And the first thing we were quite pleasantly surprised at, that we met quite a lot of the commitments already. And the ones we didn't meet, we thought would be a real benefit for the school. We've been wanting a while to achieve the healthy school status, and we felt that this whole pledge would be a huge help with that, and would be kind of a stepping stone in the right direction. Me and a colleague went to the initial meeting, me and Chloe went to the initial meeting, and we really liked everything we heard. We thought it was a really good way of changing the school ethos, changing things, making change in school that we thought would be really beneficial. And we decided that, yeah, it's something we'd like to go for. So we decided we were going to adopt the pledge and start our journey to adopting it. Again, Beth's already mentioned about the commitments. So we had a look through the commitments. We were really lucky at our school that I'm on a PSHE team with another leader who's been on it for years, who's done a really good job. And we've got a really good PE leader. So a lot of the commitments in terms of PSHE and commitments were already met. We already did some of the recommended campaigns, such as Work to School Week and Healthy Eating Week. So it wasn't like when we saw the commitment, it wasn't like, oh my goodness, it's going to be so much work. It was actually, this is great. We actually meet quite a lot of these things. And then the ones we didn't meet were things that we really wanted to change anyway. We had a real issue with packed lunches, with children bringing in just totally unhealthy things. For example, one day someone brought in 2 donuts for the dinner. And we just had real issues with that. And when we tried to address it with the parents, we didn't really have anything to kind of give a reason why, other than we're trying to be healthier. So using the FAF as a way of addressing this was something we thought was really useful. And we felt that we wanted to change the whole school ethos, really. We wanted to become a healthier school. We wanted to be more active. We wanted to really make sure that when our children left in year 6, they were physically active and they knew how to live a healthier lifestyle. And we thought it's a really, really good way and sort of a huge positive impact on this. Next slide, Nuri. Thank you. So we had our launch event. Here I am serving healthy food. It was great. We had a really nice launch event. It rained, but that didn't stop anything. The parents all came. It honestly was brilliant. I'll talk about the kind of few stepping stones in a minute and the challenges, but by the launch event, all these were done and it made it so much easier. I think our main challenge was the staff, because I think it's really important if you're going to adopt the pledge that your staff need to be on board. If you're going to ask the children to be eating healthier and act in a more healthy manner, you need your staff to be showing that as well. So we kind of asked staff to make sure they weren't drinking fizzy drinks or drinking juice, and they were modelling drinking water. They would make sure if they were going to eat in front of the children, they were going to model eating healthily and not eat crisps or biscuits in front of the kids. We were talking about trying to have a more healthy staff room, and maybe rather than people bringing in biscuits and things for the birthday, they could bring in fruit. And there was a lot of bite back at first because it was affecting them. But then when we kind of explained why and explained the benefits and explained the reasons behind doing it, they all got on board. Parents at first were in a city school, and the main thing that people first said was kind of the packed lunches they were sending in and the food they were saying is all they could afford. When we kind of explained how you can get fruit cheap and other things like the parents did come around. It took a long time with packed lunches. We had to make a new packed lunch policy. We had to roll out the packed lunch policy. We sent everyone letters home about the packed lunches. We used a lot of the stuff from the toolkit that Beth had given us, which was really, really useful. And it's taken a long time, but this year we've had no problems with packed lunches. Everyone knows what we expect, and it's not been difficult at all to police it. And one of the biggest things I think we had, big issues with birthdays, and I don't know if people are aware of this, a lot of people for children's birthdays bring in sweets for children in their class. And already we had an issue with this because we've got a lot of Muslim children in our school who it wasn't vegetarian, so they couldn't eat it anyway. So that's caused issues. We had a lot of parents who couldn't afford to bring sweets in for their children, so they weren't happy anyway. So it's something we wanted to stop anyway, and we saw this as the perfect opportunity. But some parents were really happy that their children weren't allowed to bring in sweets. We had to kind of explain why we were doing it, and they still weren't happy. We had people waiting outside the school gates to give sweets to children as they left the school instead of that. But again, we found that once explaining it properly and explaining why we were doing these things, parents did generally understand. And ultimately, we're doing it for the benefit of their children, and we're doing it because we want their children to be happy and healthy children. So we did get the message across eventually. I think I could go on for ages about the benefits of our school. It's just had such a massive impact on the school. We are so much healthier. The dinner hall is so much nicer to be around. The school food is massively, massively improved. We use this opportunity to change what we do at school club and breakfast club. We got the school catering staff involved, so they have a massive improvement. We had massive pushes on kind of giving children stickers for trying out new vegetables. There's been loads and loads of things, and parents are so happy. We've had loads of parents that are now talked about that they find it better at home because their children now are happy to eat healthier at home because they've tried it at school. I think one of the big things for parents is it's late. The children get home at 5. They're tired. They've been at work all day. They don't want to try and force them to eat things they don't want. Whereas at school, we've got them. It's 12 o'clock. Sometimes they're different persons, but we find it much easier to kind of convince these children to try healthier foods, to eat healthier packed lunch, and that's helped a lot. We've seen massive benefits in both physically and mentally in children at our school. Now they are physically active and they are eating healthier. They are mentally much more, they're much better mentally, and we're seeing that a lot. And the staff are really happy. Now it's all settled in, the dust settled. They're really happy. It's nice to see your children happier because they're active and they're eating better. So yeah, it's just been such a positive, and I think it can be quite daunting when you see it at first. Not what you think, Beth, quite daunting when you see all these 12 pledges at first, but it's not. It really, really isn't. It's such a nice and pleasant experience. There are some bumps, but at the end of it, it's so well worth it. I really think it's something worth doing. Thanks.
Thanks so much, Jack. I really enjoyed that, and thank you for taking your time. I know it's a busy day for all of us, but I'm very conscious of what it must be like as a primary school teacher as well. Next slide, please, just before I open this up. Thank you very much, Beth. Can I ask all the speakers, Jack, hopefully you'll be able to stay with us another 10 minutes or so, Alistair and Lisa, to put their cameras back on. We'll see what we can do in terms of answering all the questions that have come through. I think I can see the questions and answers myself, which is good. We're not necessarily going to be able to answer everything. Perhaps I could ask if Nicola and Beth are able to respond to any questions we're not able to take within the time of this webinar afterwards. Hopefully you're able to do that. If there was common ground, there was a lot of common ground actually, apart from the enthusiasm across all the presentations. But what I felt particularly was whether you're talking about schools or you're talking about NHS organisations, system leadership is not telling people what to do. There's very much there about practicing what they preach. And when Jack was talking then, when he was talking about any issues, the first thing he put up was staff and talked about how that was addressed. And that's exactly the same within the NHS. And I was really pleased when Alistair started talking about the size of the trust and the number of staff who work in it and how that was incredibly important. They could look at that. I can't see Alistair and Lisa. Are you live? Are you back on? I can't see you, but I don't know what that means. Yeah, you are. Sorry, I can see you now, Lisa. I think I probably can see who spoke basically. So, okay, we're not going to be able to take all the questions, and I've noticed one or two have been answered already. I think the first question was it came through quite early and was specifically about the NHS setting, I think. So I'll put that. I can see you, Lisa or Alistair, if you want to answer this. It comes from Sally Hogg, who I know is in Bristol. Sally has asked, how have you overcome issues with unhealthy food in food commercial outlets, or have you been able to?
Certainly within our own premises, we don't have a lot of commercial offers, and where we've got commercial, we've tried to go with a healthy option. It's fair to say you can still get chips in the canteen, and we had one or two people saying that, you know, should we ban that? But I think the feeling was that's probably the wrong approach, as opposed to making the healthy options more appealing. So we've looked at pricing. We've not, as Lisa said, we've got the food ban going to all the sites. So we've tried to make the healthy options as visible and more popular, rather than actually banning things like chips and slightly more unhealthy options. And I think that it's partly a nudge, because I think if we just ban things, that probably wouldn't go down that well with all of our staff.
Thanks very much, Alistair. Yeah, that's helpful. I mean, some of these are quite nuanced, aren't they? And it's about approaches and tactics as well. Alex Hancock, I can see your query about resource packs. I'm also noticing that some of the questions are being answered even as I speak. So thank you to Nicola and Beth where that's been happening. To say that information about both the NHS declaration and the Schools Pledge for a Healthy and Active Future, information about them will be available later, and certainly can be made available for local authorities. Alex, I think Alex Cosmos has asked a question actually about the Schools Pledge in terms of it's a general question about how we may be able to roll it out, but I think I'm going to ask Jack a question, specifically the second part of Alex's question. How do you ensure that school leaders, a harder question here, how do you ensure that school leaders are held to account and take part in the commitments? Jack, you're able to answer that?
I don't know if I can answer. We didn't need to be held account for us, because we chose to do it. We looked at it and thought, this is just something we want to do. And the leadership team were well on board before I got involved. So I was asked to be involved because I'm the PSHE lead. So it's a bit different for us. But I don't really know if that helps at all.
No, it does. No, it does. And I think the whole point about you talking about Schools Pledge or the declaration is it's not something that can be forced. You've got to have that senior leadership buy-in, otherwise it ain't going to work. And you know, there's lots of experience of that. You have to have that support there. So thank you for that. We are having this being recorded, so everybody's presentation will be recorded on this. I think I've gone through all the questions that I have live on the questions and answers. If anybody does want to put something through in now, please do. I think I probably will ask just one general question then, which can go to both Alistair and Lisa and Jack from their perspectives. We've talked about these as tools to support healthy weight. One of the sort of big questions that most people ask is about the resources required, and resources, generally speaking, is your time. Can you comment about that, if that's all right? Jack, I can see you, so I'll ask you to start, and then I'll ask Alistair and Lisa if they wouldn't mind commenting from the NHS perspective. Jack.
I think it obviously does take some of your time, but it was nowhere near as much time as I thought it would, because the support pack is there's so much there. So in terms of letters, anything you think you might need to start making, it's already there and done for you. So it's kind of just, it probably took me about an hour a week of my time, on average about an hour a week of my time.
Thanks. That's great to be specific like that, because people often aren't, so that helps. Thank you. Comment from Alistair and Lisa. I know that it's a big trust. There's a lot of work involved here. Would you like to comment?
I'll bring Lisa in a second, but I think there is a bit, particularly when this is our own staff, that if you relate this to how you invest in your staff about that CSR, actually, if they're healthier, actually the investment that we're putting in compared with sickness, absence, or any number of other bits, it probably pays dividends by a long way, purely from, we know we've got good soft rates. This is just part of that investing in your own workforce approach. I know that's slightly different from schools where you're investing in the children, but I think that fundamentally means that it's actually time very well spent. Lisa, do you want to comment on the specifics at the time, because you're doing more of that than me?
Yeah, so I would say the planning was more time consuming, you know, in terms of looking at the benchmarking tool. That's where we started. So we looked at the benchmarking tool, mapped that against what we were currently doing across the organisation, and then looked for the gaps, and then we used that information to inform our action plan. So I think the first sort of 6 months and getting yourself to the point where you've done the benchmark and you've got an idea on where you want to go, you've got your key stakeholders together, that is more time consuming. But everybody in health has a shared interest in healthy weight, so it's part of all of our roles. And I think we've just, in our steering group, we've all got our day job, but our day job all involves an element of public health. So it's kind of, we all do it as part of our day job, but there is a time commitment to meeting, to ensuring you're up to date and on the action plan and things like that. And I would say you do need somebody to kind of lead the early bits of it and pull people together. But then a lot of it is just that partnership working going forward.
Thanks very much. That's very helpful, and thank you for being honest about what you put into it and what you've got out of it, which I think is absolutely great. I think I'm going to, at this point, thank all the speakers, Alistair Blair and Lisa Davis from Northumbria Healthcare, and I can thank Jack Waddle from St Bartholomew's in Armley. Really enthusiastic presentations and really excellent. So congratulations to them for the really excellent work they've been doing, which hopefully we're setting the scene for a lot of other NHS organisations and schools to follow. Can I have the next slide, please? Oh, sorry, you've already put it up, Beth. I'm busy thanking people. I hadn't even noticed you've done that. So for anybody who is interested in finding about new tools launched today, and thank you also to Nicola and Beth for your input for this. I neglected to thank you. They'll be the ones that no doubt will be responding to the queries, and people who wanting to find out more about the new tools launched today or the local authority healthy weight declaration, please do get in touch with them. We've also put some links in the chat, I believe, to find out more on our website. Just go to our website to find out more. So I suspect that's the final slide, is it? Or is there one more? I can't remember. Beth just put a link in now. So thanks ever so much for attending. We had a really good turnout today. Thank you to all the speakers for providing such valuable insights and taking time away from your work, and for everybody else who I hope will be able to follow on and do some of the work we've heard about today. Lovely to see you all. Sorry it's all online and not in person. Enjoy your lunch, and hopefully not 2 donuts, which I made a note of when Jack was talking about before. Goodness me. Have a good day. Cheers for now. Bye.